Joining us now is Jessica Martinez. She's co-executive director of the National Council for Occupational Safety and Health. Ms. Martinez, it's a real pleasure to have you with us tonight. Thanks for making time.
Thank you so much, Rachel, for having me. I appreciate this time.
Let me ask you first, in terms of the way that I have explained this so far, if that comports with your understanding, if you and your organization are looking at this through a different lens, or if I've gotten anything wrong.
Yeah, so I'm here representing National COSH. We're a federation of local COSH groups that are advocating promoting health and safety working conditions. We're getting calls every day from workers who are scared to death of going to work. They're scared for good reasons. Essential workers are dying all over the U.S., and that doesn't limit itself to meat processing workers, but healthcare, postal workers, farm workers, transit, grocery workers. We've documented hundreds of deaths on our website, and that just is representative of a fraction. This isn't just a problem for essential workers. Infectious disease doesn't stay contained in the workplace. We know that as soon as that worker steps out, potentially infected, it's impacting communities, neighborhood, public spaces. So this is an issue for all of us to take into our hands and take action. As a result, our organization released a safe and just return to work report after receiving tens of calls from workers, efforts to organize. We know that now workers are feeling more empowered to make demands, taking matters at their own hands. We've seen over 200 plus walkouts, sick leaves, big companies like an Amazon, Instacart. Just last week, we know that Ford workers in Michigan walked out as soon as they found out a worker tested positive for COVID-19. So with that said, we know that workers have the power to be able to make these demands, both to the employer, government agencies. We know the federal agencies at this moment, OSHA in particular, the Occupational Safety and Health Administration, who has responsibility to ensure health and safety working conditions for all workers across the country, has minimized their enforcement. COVID-19 has killed more workers in this short period of this pandemic, yet not one citation has been given to an employer because of COVID-19. That is a huge problem. Now is the time to have more enforcement for our government agencies. Former chief of OSHA, Mr. David Michaels, had assured us that OSHA has the teeth to be able to have the authority to put emergency standards in place. We're seeing less of this. CDC guidelines are too weak. We're more and more seeing voluntary programs as the states are starting to reopen. Voluntary programs are not the language we need to hear. Right now, it's mandatory programs as we're seeing more and more workers are impacted.
Let me just underscore, make sure I understood something that you just said. In terms of the federal, there is a part of the federal government that is responsible for making sure that people work in a safe environment. OSHA, the Occupational Safety and Health Administration. Out of all the people who have been infected on the job and all of the people who have been infected on the job who have died, OSHA has yet to issue a single citation to any workplace in the entire country for COVID-19 safety issues?
That's right. That's right. And as you can see, and we're trying our best to document it. It's astonishing. And again, it's a problem with enforcement. We know that particularly this pandemic has revealed longstanding inequities in our country. We're all focused on it now, but for far too long, we know that the low pay and dangerous conditions faced by millions of workers has particularly impacted Black and Brown communities. Black and Brown communities have the highest mortality rates around COVID-19. We know that Latino workers make up 18% of the working population, and 35% of slaughterhouse workers are Latinos. African Americans make 12%, but 34% of those are correctional officers. These are our essential workers. These are the folks that are having to go to work on a daily basis to protect their livelihood. We are putting a gun at these workers, essentially. If they stay home, they're not making enough of a living wage. They can't provide for their families, pay rent. If they go home, there's not enough protections, and we're not ensuring the safety protocols to ensure that they do not get infected. It's really, really amplified a problem that we've had across this country in terms of the inequities. There's no law that says Black and Brown workers have to get the most dangerous jobs. That's discrimination, pure and simple, and it has to change.
Jessica Martinez, co-executive director of the National Council for Occupational Safety and Health. Thanks for your time this evening. What you're talking about in terms of there having been more than 200 walkouts around the country and workers all over the place standing up for themselves to try to get safer standards, that's something we're really interested in covering in an ongoing way. So please stay in touch with us. It's good to have you here.
Thank you. Thank you, Rachel.